Ladies and gentlemen, we'll go ahead and call our meeting to order so that we can run through our part of the budget, the community health part here. I'm going to go through there, and then when we finish, we'll hear from the committee, and if you have questions or comments, we'll work that out. As you know, when we look through here, you're going to see a lot of different transfers in here because of the three programs, the ABD, the LIM, and the Peach Care, and some other things. A lot of this is going to look like it's new money, but it's transfers, and we'll talk about that as we go through. Okay, 17.1.6, this is simply a transfer there from 17.7.12 to initiate contract services for the nursing home audits that we need to be doing. Next will be on 17.4.6. This is an elimination of $500,000. This was for the two FQHCs that we did last year. It was one-time money, so that comes out. 17.4.7 is an add for two federally qualified health centers. One would be in Cook County and one would be in Lincoln County. 17.4.8, this is to provide funds for the Center for Rural Health Support and Study at Augusta University. These would be working with some of your rural hospitals to help set up rotations through surgical procedures through rural hospitals, swing bed programs, and this sort of thing, something to help our rural hospitals hopefully continue to stay in business. 17.5.5, this is to a transfer from 17.7.13 to provide an increase in the salary for the nurse surveyors. You'll remember the nursing homes were having issues with their backlog of complaints, and this is an effort to get them the people they need to handle those in a more timely fashion. 17.6.1, this is just language only to say that the hospital provider payment program shall not exceed 1.45 as the law dictates. 17.7.12, this is a transfer to the Department of Administration and Program Support to initiate contract services with the audits for the nursing homes. There again, we mentioned that back in 17.1.6, just a transfer. The next one, 17.7.13, is also a transfer. This goes for the nurse surveyors. That's back to 17.5.5. 17.7.14 is the transfer funds from the low income program for a 3% inflation adjustment for the nursing home cost report. That comes from 17.8.15. 17.7.15 is also a transfer for a 3% rate increase for the source case management. They'll be serving over 15,000 people. And let me say, I should have mentioned this before we started. We had requests for over $70-some million requests, and they were all had merit, but obviously there wasn't enough money to handle that. So your committee worked hard, I think, trying to sort through those and do the best we could, but it was obvious we didn't have $70 million to put in there. 17.7.16, this is utilized $307,000 in existing state funds for a 5% reimbursement rate increase for dental codes. You're going to see that in all three programs across the budget there. 17.7.17 is a transfer from low income for the period of attestation for the increased reimbursement from your primary care code rates. This is where some of the providers who were doing primary care were not paid that higher rate because they had not gone through that attestation period. This will allow community health to have 6 months to bring those people up, so we're paying everybody the same for the work that they're doing. That'll begin January 1, 2018. That's $1.13 million. 17.8.11, this eliminates some one-time funding for the evaluation of an ADHD cost savings program. It's due to be completed July 1 of 17, so we don't need that, and that's a cut of $200,000. 17.8.12, utilize 2.3 in existing funds there again for the dental reimbursement increase. This is under the low income program. 17.8.13, utilize 5.2 in existing funds to match the federal funds for the new period that I mentioned about attestation for the those with the primary care codes. 17.8.14, this transfers funds for a new period. That's the cut for that 1.1 that I mentioned back in 17.7.17. 17.8.15, this is the money that was transferred and moved back to 17.7.14. Same thing with 17.8.16. That's a transfer back to 17.7.15. Under Peach Care, 17.9.3. This is to provide funds for a 5% reimbursement rate for the dental codes under the Peach Care. And you'll notice the total, there's no state dollars because all that money is federal dollars. Same thing with the 17.9.4. This is the increase for the primary care codes. Same thing, no state dollars, but the federal dollars on the Peach Care program. Okay, 17.12.1, Physician Workforce Board. This is transfer funds from the Public Initiative Program to Board of Regents and increase funds. This is where they had 127 new residency slots, but only 97 are ready to go, so we were able to save about $725,000. Simply, they just weren't ready at this time and didn't need that. 17.12.2, this utilizes $219,000 that's already in the budget for the accelerated curriculum program on Memorial Campus in Savannah. No new money, just language to allow them to more efficiently use that money. 17.12.3, this is to provide funds for 2 additional OB/GYN slots at Emory, MCG, Memorial, Morehouse, and Navicent. This is the capitation that we pay on these slots, $15,333 for each. 17.12.4, provide funds for Memorial Medical Center to partner with Gateway Behavioral Health to start a psychiatric residency program. That's $360,000 of state dollars as a seed money to get that started. They're going to foot the bill for that down there, and it'll be a program where they'll have 6 residents each year for 4 years, so it'll be a total of 24 in their psychiatric program, something that's really needed. Under the Morehouse, 17.14.1, this is a transfer from there down to 17.16.1. 17.15.1, this eliminates one-time funding for the Georgia South Family Residency Training Program. That was a one-time shot. It's no longer needed. 17.15.2, this is a $100,000 add for 10 additional slots for the physician assistants and nurse practitioner to participate in the loan repayment program. We've had 20 slots last year. Those were taken and had a waiting list, and if we don't put new money in there, they won't be able to take any new applicants this year. So we're putting enough in there for 10, and we hope our friends across the building will look favorably on that too. 17.16.1, this is the transfer I mentioned earlier. It goes up to 17.14.1. That comes from there. Drugs and narcotics, 17.18.4. This provides for the 20% pay raise for the post-certified officers. Same thing that we had done with other post-certified officers, but they were omitted when we did that, and this will bring them up to that 20% raise like all the post-certified officers got. 30, under public health, 38.1.6, this is provide funds to establish an adolescent to adult transition model to improve outcomes for adults with autism spectrum disorder, $325,000, and they'll be working with Emory on that program. 38.4.5, this is to replace funds for the regional coordinating hospitals, to replace federal funds for preparedness with all the tornadoes and the hurricanes we've had and this sort of thing. These 14 hospitals strategically placed around the state play an important role in providing care in the case of emergencies, and their funding had been dramatically cut. So we're recommending that we put $10,000 in for each of those 14 to help them bolster up to take care of these emergencies that we've been having and will continue to have, I'm sure. 38.10.6, this is to provide funds for additional environmental health specialists in the health department. They had requested 115 positions, new positions. We know that they need them, but we obviously just could not afford to do that, so we're recommending that 15 of these specialists be funded. 38.12.5, this is to provide funds to complete the phase-in for the grant and aids to hold harmless to counties. This is at $1.3 million. This is the 7th and final year of that, and this goes all across this state, so that will finish that program up. And that's the last change that we have. What's the pleasure of the committee?
Second.
Have a motion and a second to pass. Any other discussion? All those in favor say aye. Aye. Any opposed? Thank you.